Meals on Wheels. Thank you for what you do in your community. I will add this. What Lisa does is nothing new to me. She's involved, obviously, in Meals on Wheels. My wife and I are heavily involved in Meals on Wheels. My wife has been delivering Meals on Wheels for about 10 years now on a weekly basis. And she sees firsthand the vital role that Meals on Wheels plays in the lives of people in our state. They do provide food, which is important, but they provide so much more. They provide compassion, they provide conversation, and related to what we're talking about today, they provide a way for people who are involved in Meals on Wheels to learn about our seniors who may or may not be getting vaccines, and that helps us as a state better respond to the challenges of the people who are on the receiving end of Meals on Wheels. We have Mayor Guajardo with us here today. Thank you for being a part of this, and thank you for your leadership. I'll be coming back to that here in a second, applauding you and your team for everything that you've done in achieving the great success here. And we have City Manager Zanoni, as well as City Council Member Michael Hunter, and there's a lot of other people behind me. Maybe the most important people we have with us are the men and women in uniform behind us who put their lives on the line every single day working for the health and safety of the people of this community. We're here today to talk about, in part, what Corpus Christi has done with the coronavirus vaccination program, and especially the emphasis on seniors in this community. I am, as governor, incredibly proud of the Corpus Christi Fire Department, Meals on Wheels, and the city of Corpus Christi for what they've done to step up to identify and then vaccinate homebound seniors. I want to thank everybody involved in this entire process in the Corpus Christi area for turning this program into such a successful operation. Vaccinating our seniors is our top priority. The main goal that we have in the vaccination process right now is obviously to save lives and to reduce hospitalizations. Medically and mathematically, the best way to do that is to vaccinate our seniors as quickly as possible. Now, some of our seniors do have the ability to go to these vaccine hubs or to some other location, such as a drugstore, and get a vaccine. However, there are other seniors who don't have the physical ability to travel to one of these hubs because they are homebound. And that is the importance of the program that Corpus Christi has established to make sure they're able to get those vaccines to those who are in need. So Corpus Christi was able to solve this problem. And they solved it with the problem by getting vaccines to those homebound seniors, and it has a very appropriate name called Save Our Seniors. Its success, or let's say the success, that has been achieved by Corpus Christi, as well as some other cities like it across the state, like San Antonio and Arlington. It is so important that we are announcing today a statewide program to save our seniors. The state will deploy more than 1,100 National Guard across the state to help communities vaccinate homebound seniors. Some National Guard will be involved in the identification and registration of the seniors in the community to get them on the list to be able to get the vaccine. Other National Guard will be involved in the vaccination process. This effort begins this coming week. Initially, we thought that for the first week we would have about 8,000 vaccines to administer. Because of the approval of the Johnson & Johnson vaccine, it may turn out to be 2, 3, or 4 times that amount of vaccines that will be available. We're looking to ensure that the medical qualifications to ensure that the Johnson & Johnson vaccine will be appropriate for the senior population. If it is, this first week will be far greater than just the 8,000 vaccines that we know we will be able to start with. The National Guard, they will collaborate with the communities they are serving. The reason the program in Corpus Christi has been so successful is because of information provided by partners like Meals on Wheels. We will work with programs like local fire departments, like nurses that visit homes, and nonprofit organizations like Meals on Wheels. These groups will work, or they do work with homebound seniors every day. And so they have the information that we as a state need to be able to identify where the homebound seniors are who have not yet received a vaccine. Our mission is very simple, and that is to get our seniors vaccinated as quickly as possible. As of yesterday, about 40% of all seniors identified as those who are age 65 and older have received at least one vaccine in the state of Texas. Our goal is by the end of next week to have that number up to 50% of seniors having a vaccination, and to have all of our seniors vaccinated by the end of March. And that is all seniors who choose to have a vaccine. The reason why this is important is when you look at the bigger picture of the state of Texas, normalcy returns when we are able to reduce the number of hospitalizations as well as reduce the number of deaths. And watching the numbers, it looked like Corpus Christi did a really effective job in being able to constrain hospitalizations. Mary, you may know better than I. My recollection is as other regions went into lockdowns because their hospitalizations were above 15%, Corpus Christi actually never went into that, and you were able to stay out of it because of the effective job that you're doing, and it could be a byproduct of the focus that you had on vaccinating seniors. We want to make sure we replicate that success across the state of Texas. We want to thank our local partners. We want to thank leaders like what we have here in Corpus Christi, as well as leaders across other regions of the state of Texas for working so hard. The good news is there's going to be a record amount of vaccines available across Texas this week. With increasing numbers going forward, we're going to have the capability to run out or apply vaccines very, very quickly for our seniors as well as additional population, so that we increasingly, week by week, will be increasing the immunity that Texans have. With that, I'm going to pass the mic to Chief Nim Kidd, who is the Chief of the Texas Division of Emergency Management.
Thank you, Governor, and I also want to thank Senator Hinojosa and Chairman Hunter for the work that they've done, giving us the guidance and the tools and the capability to go out and do this job. Mayor, thanks for your tireless work. You know, the city manager and I have worked together for many years in previous lives, so great relationships, and y'all have built a great team here. That's why I'm excited to be here with Chief Rocha. Great partners. Several of the folks standing behind me, we've worked with for 20 years together. Just good, solid partnership. Thank you for that. Yes, our focus has been to go fast, to go focused, and to go pharmacy. And pharmacy will include going back to family practice doctors and our federal qualifying health clinics. The go fast was started off right here in Nueces County and Corpus Christi and Robstown by using your fairground. And y'all went very fast in moving mass amounts of vaccine. That was a big help. But you quickly jumped on the focused, and that was finding our homebound, those that don't have the access to get to these sites, those that can't get to a doctor. And so this is the model that we want to replicate. Now, not every community across the state has a Corpus Christi Fire Department, Governor. And so that's why Major General Tracy Norris, standing behind us in the Texas Military Department, will be filling in those gaps for the communities that can't do what has already happened here in Corpus. We want to continue to push vaccine. The one thing we constantly hear and that we consistently strive for is more and more vaccine. The more vaccine we get, the faster we can go, the more focused we can be, and the faster we can put this behind us, Governor.
Thank you very much. You mentioned somebody very important, and that is General Tracy Norris. General, I want you raise your hand so they can see who you are. She is the general in charge of the National Guard in the state of Texas, doing a very effective job of dealing with the winter storm, a very effective job of dealing with helping to respond to the COVID-19 challenge, as well as so many other challenges. And we appreciate both you, but also every member of the Texas National Guard. Next, we have Chief Rocha. I think you're next.
Thank you very much, Governor, and also Chief Kidd. I want to welcome you to Fire Station 18 with the Corpus Christi Fire Department. And I have to tell you, there are so many people to recognize for the City of Corpus Christi's SOS program, Saving Our Seniors. First, I want to recognize our mayor, Paulette Guajardo, who has been so instrumental in the development and execution of the SOS program. The success of the program is predicated on the ability to access vaccine, and our mayor has made sure that the SOS program has what is needed to deliver and administer vaccine. Thank you, Mayor. Also, our County Judge, Barbara Canales, along with our Health Department Director, Annette Rodriguez, have also engaged the state to bring vaccine here to Corpus Christi and to Nueces County. The partnership between our civic leaders has delivered to the city and the county vaccine so desperately needed. Our state legislative delegation has also been accessible and helpful in this vaccination endeavor. I want to thank Representative Todd Hunter, Representative Abel Herrero, and our Senator Chuy Hinojosa, and the entire Texas legislature for their leadership and their support. Lastly, I want to acknowledge the tremendous teamwork by the firefighters from the Corpus Christi Fire Department who have worked long hours to deliver vaccines to our homebound seniors. Over 2,000 doses have been administered, and we are now delivering our second doses. The SOS program, I am proud to say, is being replicated in cities like San Antonio, Victoria, and Robstown, delivering doses to those incapable of conventional vaccination. Many say that our children are our most valuable commodity. I believe it's our seniors, those who make up the greatest generation of our country, who deserve to have the vaccine delivered to their homes. Governor Abbott, thank you for recognizing the valiant effort by the Corpus Christi Fire Department in taking care of our seniors.
Thank you.
Thank you, sir.
Thank you for your leadership. Thank you for the service of the people who stand behind us right now. We know the difference that they make. You know, one thing that you mentioned was teamwork. And an essential team member in this process for both Corpus Christi, but also for what the state wants to accomplish, is Meals on Wheels. And today we have with us Lisa Oliver with Meals on Wheels.
Thank you, Governor. Well, as Chief Rocha stated, this is truly a community effort, and it's a team effort. Multiple city departments coming together to ensure that the most vulnerable are vaccinated in our community. As plans were being developed by local leadership, such as the mayor, council, and executive team on how to better serve the community's most vulnerable, the elderly and disabled that were homebound, the Parks and Recreation Department was contacted by the Corpus Christi Fire Department on a proposed partnership. The collaboration included working together to vaccinate the clients of the Meals on Wheels program and other seniors participating in programs offered by the City of Corpus Christi. The local Meals on Wheels program is one of 300 programs throughout the state of Texas. The City of Corpus Christi sponsors the Meals on Wheels program, which provides over 600 clients meals on a daily basis. By utilizing the Meals on Wheels program to launch the homebound senior vaccination effort, it maximized resources readily available. Staff provided client names that included meal routes, which assisted the fire department personnel to deploy their vaccination teams. In addition, staff contacted clients on the Meals on Wheels program to ask if they would receive the vaccine. And we're proud to see that this program is being replicated throughout the state. We often say the Meals on Wheels program is more than just a meal. The program delivers the support that enables seniors to remain living at home, and often with in-home support. The benefits of the home-delivered meal programs throughout the state and nation include reducing malnutrition by providing healthy meals, the human connection, daily contact with others, such as the governor was referencing that his wife provides as a driver. Also, improving the client's health, as previously stated, may reduce hospitalizations and decrease the length of stay and helping to maintain their health. And now we're proud to say includes receiving in-home preventive measures, such as the COVID vaccine, to improve their health. The prevention of COVID among the homebound by administering the vaccine impacts more than just the individual. It creates a ripple effect. It also benefits those that have daily personal contact with the homebound client, such as caregivers and those that provide in-home services, whether it be home health, physical therapy. Back in July, I also had a personal experience with my mother contracting COVID from her provider, from her home provider, and subsequently, I too contracted COVID. We know there are many more in our community and throughout the state that have had a similar experience, and this program will benefit all. To date, approximately 2,000 homebound vaccines have been administered through the Saving Our Seniors program. Thank you to Mayor Paulette Guajardo and the city leadership for the implementation of this program to benefit the most vulnerable in our community. Thank you, Governor.
Thank you very
And
much.
staff.
And listen, thank you for the role that you play. Serving seniors, whether it be meals or serving hope, it makes a big difference.
Thank you.
Sure. We'll take a few questions.
Governor, now that you've addressed seniors and homebound, when can all Texans expect to get a vaccination?
The good news that relates to that is that the number of vaccinations being made available to Texas is increasing dramatically. This week, we're getting the largest amount of vaccines ever, and that is well over 1 million. And I've been told by the president to expect more than that in the coming days, and then that, of course, increases with the addition of Johnson & Johnson. So the way that it works from here, there is an expert vaccine evaluation panel that makes the decision about who goes next. They made their initial decision for people age 65 and older because those were the people who were most likely to either die or be hospitalized for contracting COVID. I assume they will be using the same type of analysis in their next determination, knowing that saving lives and reducing hospitalizations is the most important, but it will be up to that expert panel to make that decision.
So at this point, do we know when those who are not being waiting 1 day or when?
Yeah, there's a plane flying when you ask your question. If I could get you to speak up a little bit.
That's the first, sorry. So then do we know when those state will open vaccine distribution to other phases of just 1A and 1B?
So with the amount of the vaccines that we are getting, I would anticipate being very soon being defined as sometime in March.
Governor, how many other issues? I want to ask you when it comes to the statewide Save Our Seniors program. I've spoken to other many counties, smaller counties such as Forest County, Yukon, Law. They're worried that they're not getting enough vaccines, especially for their homebound. How important is it to vaccinate our homebound individuals, especially in those small counties who feel left out?
It's absolutely essential that we provide vaccines to what I will categorize as the less populous counties. And we actually have already begun that process with the National Guard for several weeks now. The National Guard has been going typically to about 5, what I'll categorize as rural counties at a time, working to provide vaccinations throughout that entire county, and that process continues. That said, Chief Kidd may have more to add to it because he's been one of the organizers and implementers of this program. I just want you to know, especially for the people in those counties to know, that we know about their concern, we know about their need for these vaccines. This program will be one of the steps that will assist in addressing their needs, but also this oncoming increase in the number of vaccinations will help. Then finally, I will say that the use of the National Guard will assist in that process in those counties. But Chief Kidd, do you have more to add?
I do. Thank you, Governor. And one of the things that I want to be clear on is we all want more vaccine. Everybody wants more vaccine. So the expert vaccine allocation panel took the population of Texas counties whose ages were 18 and older, and that is a percentage, each county is a percentage of the overall state total. Now, while we believe we're a state of about 29 million people, the truth of the matter is the 2019 census says we're at 21.5 million people age 18 and older. So every county's percentage of that 21.5 million is a factor that we look at based on the allocation of vaccine to us each week. We are staying within 0.5% difference in the population versus vaccine allocated. So that's how we're trying to be as fair and equitable as possible for all 254 counties and 1,216 cities. On top of that, to your point with the Saving Our Seniors, as additional vaccine comes into the state, where we want to go are to those places that don't have the same access to health care, that their populations have not been vaccinated at the same rate or the same amount. and make sure that we're giving the Texas Military Department, working with our local officials, those mayors and judges of those rural areas are the ones helping us determine where to go and what groups to help vaccinate with. So this will be a collaborative effort with the local and the state resources, and we don't want to leave anybody out. We absolutely want to know the people in those rural areas to know that we're coming to help vaccinate them just as fast as we can and as much as vaccine is available.
Great. Yes.
When we look at efficiency, which is obviously what we want to do at this point, I know Moderna and Pfizer are a two-dose vaccination, and what I hear Johnson & Johnson could be a one-dose vaccination. In the future, based on efficiency, will the state ever endorse a certain brand to make sure that it's just a faster route to go?
Well, one thing that we've already discussed is that if the Johnson & Johnson vaccine works effectively for seniors, meaning that age group, then we think that it would be most efficient when we are going to homebound seniors to provide the one-shot vaccination as opposed to 2 shots, so that we would not be making 2 trips to homebound seniors. And we are still awaiting information about that from the medical community. If the medical community approves that approach, we think that the most efficient approach would be to use as much Johnson & Johnson vaccine as possible for the homebound seniors. In addition to that, however, it's my understanding that some of the Johnson & Johnson vaccines could also be used at some of these super sites or hub locations. But again, I think the most efficient use would be on the homebound seniors. Yes, we'll come back to you in a second. So I will be with President Biden tomorrow in Houston, and we'll talk about several things. So the first thing that we will talk about will be the winter disaster that occurred, what the needs are, and Chief Kidd and I will be there explaining what the challenges are across the entire state. We will express our gratitude for the major disaster declaration already declared, but also explain the need to expand that to additional counties. And then on top of that, we will be visiting one of the vaccine super sites they have located in Houston. And so we will also be talking about vaccines as well as the additional number of vaccines that will be coming to the state of Texas, showing that we will be able to accelerate vaccinations in Texas. We'll do a couple more here real quick.
Governor, for the storms of 1989 or 2011, there were state and federal reports that came out recommending, not mandating, but recommending that our grids, our energy sources be weatherized. Where does the blame fall at this point? Because if those recommendations had actually been taken, there's quite the possibility we may not have been in the place we are today, that there was those who lost their lives would still be alive today, and we wouldn't still see millions of people trying to get their water right.
Sure.
Why were those recommendations not taken? And I know it goes back to other Republican
Right.
administrations.
So easy answer, and that is, I cannot explain why back in 1989 or 99 or 2011, why it was a suggestion and not a mandate. But if you listen to what I said last night, I was crystal clear. This is no longer going to be a suggestion. This is going to be a mandate. I said last night, and I will say it again, this legislative session is not going to end until we both mandate and fully fund the winterization, and I will add the summerization of our grid. We never again can allow power to go out in the state of Texas.
But isn't that the point right now? It seems like the blame game is going to ERCOT. They're the ones who are being targeted as, you didn't do what you were supposed to do.
Right, sure. So, and let me give you a very specific reason for that probably has come out during the course of the investigations today. It's something that I know because of what I have learned over the past few days. There are 2 very specific reasons why ERCOT is getting the blame on this. ERCOT is in charge of ensuring that we have power across the state of Texas. ERCOT has to make decisions based upon their interpretation of what the winter storm looks like. Step 1, which was a failure on the part of ERCOT, was not taking the winter storm serious enough They downplay the severity of it, at the same time telling me and the public that they were fully prepared for it. Then secondly, in the early morning hours on Monday, at a time when power began to get compromised, meaning the demands on power were catching up with the available power, here's what ERCOT did. They had the opportunity to slowly begin to implement rolling blackouts. Instead, what they did, they delayed their decision-making process about rolling blackouts until they got right to a few minutes before the entire grid crashing, and they did the equivalent of slamming on brakes while driving on ice, and it led to a collision that not only shut down multiple thousands of megawatts, but in doing so, that is what led to the immediate additional shutdown of other megawatts of generation power. So it was their decision-making process before the storm hit, then their decision-making process in response to shutting down electrical generation units that led to the overall shutdown of more power generation units than ever before in Texas history. We got some other people here. Great question. So we're working right now on evaluating when we're going to be able to remove all statewide orders. And we will be making announcements about that pretty soon. Are we in some like flight pattern here? It's like
Same plane.
I'm having a hard time hearing you because so one thing that Corpus Christi and Nueces County did extremely well is called collaboration. And so you have city leadership, county leadership, working with state and local officials, but importantly, working in collaboration with the fire department, with organizations that really connect with the senior population, such as Meals on Wheels. People working together like that always leads to better results. And I'll add, because I cannot underscore enough, the biggest challenge in trying to vaccinate seniors is having access to information about where those seniors are. And having organizations like Meals on Wheels identify where they are really helps that process. And that's what we want to make sure that we replicate, whether it be Meals on Wheels or other local nonprofit organizations that can help us identify where the seniors are. We will have the personnel that can provide the vaccinations. We will have the vaccinations. Now we're working on the strategies like Corpus Christi has done in counties across the state of Texas to make sure we can identify where those seniors are and then quickly get them vaccinated. Thank you all.